Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond welcomes back Johns Hopkins faculty Elizabeth Stewart and Carrie Althoff to talk about the COVID-19 risks to consider this holiday season and how we can mitigate them. They discuss the disruptions we may face, but also how this year we can be much safer than last. Let's listen.
Liz Stewart and Carrie Althoff, thanks so much for joining me.
Great to be here.
Good to see you, Stephanie.
So let's start with you today, Carrie. We are hitting another holiday season. We're right in the middle of it. Another COVID holiday season. So we've just been hearing about this new Omicron variant. So tell me how things are different than a year ago and what we know.
So COVID is still with us, not different from last year, but our toolbox and what's in it, ridiculously different in so many good ways, right? So we have vaccines that are available. We have boosters to that primary series that are available. We know how well masking works. We have good data to support that. We know ventilation works. We know what we need to do to protect ourselves. And then, just as we're enjoying Thanksgiving, Omicron comes on the scene, right? And, maybe other investigators were like me, glued to the information that was like leaking out of different sources, some of the most wonderful science I've seen coming out of South Africa in just rigorous and timely ways. And, we can't get enough of trying to understand what's going on. And in, what we really have to take a 10,000-foot view and a deep breath and say, wow, this variant has been on the scene for less than a month that we're aware of. And we're already starting to have information, really good information, about three key questions. Number one, is it more transmissible? And the data are starting to show that, this is probably more transmissible. A lot more to be done there, but this is a very transmissible variant. Number two, is it causing severe illness, or what level of severity with the illness? And very little data at this point, but cautiously optimistic that this could perhaps lead to, on average, more mild or moderate disease instead of very severe disease. So that is potentially hopeful, even though when you combine those two factors together, it can get tricky, because even though most people might have a moderate response in terms of illness to this virus, if you have a huge number of people getting infected all at the same time because it is much more transmissible, it doesn't really matter if it is causing a lot of moderate illness, because there will still be people who get severe illness. And we need to be careful with the healthcare system. Again, we don't want to overwhelm it. And then this final piece is, does the vaccine work against this particular variant? And, we have to remember that, does the vaccine work? The answer to that question is never a yes, no. It's a dial. It's how well does the vaccine work against a variant? And, even news out this morning is suggesting that people who have been boosted are seeing a better protective effect than those who are not boosted. So just more information and data out even today to suggest, if you are vaccinated, great. If you are eligible for a booster, go and do that. If you are unvaccinated, maybe Omicron was the last kind of push you needed to strongly consider vaccination, because it does look like this variant is pretty transmissible. It will find the unvaccinated.
Mm-hmm. Liz, let's talk about traveling. We were told that it would be safe to travel, and now it's, I don't know. So talk to me about sort of the thought process behind traveling.
Yeah, thanks for that. And I think a lot of people are looking ahead a couple weeks and maybe have travel planned and are trying to decide what to do. And I think it's important, throughout the pandemic, Carrie and I have been talking a lot about thinking through how to keep yourself, your family, and your community safe and healthy. And I think we can still think about that with respect to potential travel. So first, as Carrie just said, individually, we know now that we have access to vaccines. And so sort of first step to keep yourself safe and healthy is to get vaccinated. Family, you can think about rapid tests and also, well, encouraging your family to get vaccinated and helping them do so, but also using rapid tests if you might know you have an exposure. And maybe we can come back to talk about rapid tests a little bit more. And then sort of community, we think about mask wearing and normalizing mask wearing, and also just sort of staying mindful of these stresses on the health system that Carrie implied. So just being thoughtful about activities and keeping in mind that you might be keeping yourself safe and be vaccinated, but sort of we want to all make sure that our whole community stays as safe as possible too. So I think people can travel safely. I myself just got back from a trip to actually a fairly high case load area in the United States. But so with masks, again, with some rapid tests that I think, again, we can turn back to, I think travel can be safe, but we want to do it carefully and thoughtfully. And you especially need to think through sort of implications of any potential exposures for either that travel or subsequent activities.
Mm-hmm. This is all feeling very disruptive. So I have two children in high school, and they go to different high schools, and I got 7 community letters in 3 days saying that there had been individual exposures, that my child was not exposed. What am I supposed to do with that information, and why are we seeing so much of it?
So this can be a part of the fact that, we're moving back indoors. We recently, a lot of people gathered during Thanksgiving. So we're starting to see some of the play out from that. And of course, Omicron is circulating. And if more and more evidence supports that this is a highly transmissible variant, that could be where, some of these cases are coming from. It's coming from a confluence of factors, right, of where we are today in this pandemic. And essentially, the information that you're getting sometimes can feel very hard to take because it can be disruptive. Now, if you're vaccinated and boosted, it will minimize the disruption to your life because you are the most protected, and even close contacts, according to CDC guidance for kids in school, can do test and stay procedures where they're rapid testing, and as long as they're negative, they can stay, assuming that contact that they had with a confirmed case was when they were both masked and of course your child being vaccinated. So there are a lot of different ways we can reduce the disruption. But overall, the disruption is really thinking through, okay, if you do want to travel, or if you're planning to gather again for the holidays, reducing your exposures in the weeks leading up to that so you don't end up ill for the holidays. And then also keeping those rapid tests really close at hand. So it's funny, my husband's a clinician. He and I were kind of in this debate this morning about a new study showing over 70% sensitivity and over 80% sensitivity when you are testing someone who is asymptomatic and symptomatic, respectively. And from the public health perspective, that's a huge victory, right? We're catching these cases in 15 minutes. You can have your answer as to whether or not you have infectious virus in your nose. And so I think that is really important to help guide your decision-making and your behavior change. So taking a test right before you walk into a gathering, especially if you're seeing someone who could get very severe COVID if they become infected, those are all ways that we can help to prevent community spread and keep us all well. And, testing even when you're vaccinated is important too.
Liz?
Yeah, and I think I would also be thinking about this in the context of what a colleague of ours considers actionable information. So I think, in some cases, the actionable information you get is that maybe you've been actually exposed. So, maybe you were at an indoor gathering and someone there tests positive the next day, and you think, okay, and that's where you need to isolate and be very cautious. And these rapid tests can be an incredibly useful tool to monitor it. After I got back from my trip, I sort of repeatedly gave myself some rapid tests just to sort of confirm how much I could interact with my family. I think in terms of these sort of case reports at a school, it can be sort of like, well, if my kid wasn't a direct close contact, what is this? And I think there, the actionable information is that it helps give you a sense for sort of just the level of community transmission that's happening. And you can, talk with your child about scaling up or down activities. So maybe you start being extra careful about not eating lunch inside, or if so, kind of separating more at the lunch table if possible, and sort of keeping those masks on as much as possible. So I think sometimes the information can be overwhelming, and it's helpful to sort of think through, well, okay, with this information, how should I be changing my behavior?
Mm-hmm. So I, got complacent. And even though I am triple vaxxed, I went to book club the week before Thanksgiving, and we were all unmasked. And I got off the plane to visit my parents. And I had a text that a member of the book club's entire family had tested positive. So now I was just about to see my parents who are in their 70s, and I just didn't know what to do. So I wore a mask on the way to the Walgreens, and I got a test where I took it on their front porch and I was negative. But I was so nervous that here I was, I'd done most things right. And here was a moment I let my guard down and I was going to pay for it. So I guess that's something that comes to mind as well. Let me ask you, Carrie, about, I know that some people are actually still having holiday parties, and I'm curious what you think we should do to prepare for those.
So I think being vaccinated and being boosted is the first thing you need to think about when prepping for a party, right? Also, what are you going to wear? What gift are you bringing? All of those things for sure. But first and foremost, are you vaccinated? And if eligible, are you boosted? And then, right before you go to that party, I'm talking about day of, even, 2 hours before, take a rapid test. Just get that extra confirmation that you're negative and you're heading into those parties. We are moving and marching at a very slow pace, but we're doing it towards this ultimate goal where we live with COVID as an endemic virus, where it will be here, it will be circulating, but we are working towards that by building up population level immunity. And, as we work towards that, it also, is a time when we think about how we adjust our behaviors based on the risks that we're willing to take on in that moment. And so maybe you're not planning to travel for the holidays and you really, miss your coworkers and you want to go to that holiday party. And so you're vaccinated and you've taken your rapid test and everything seems good. You've also looked at your calendar for 2 weeks after. You don't have any travel plans and you don't have any big meetings or any major deadlines and you're ready to go. So, everybody is in this place where, again, we're going back to our decision-making framework. What is your North Star? And are you doing everything you can to both protect yourself, your family, and your community as we work towards building this population immunity and we live with COVID in an endemic state?
Liz?
Yeah, I totally agree with what Carrie just said. And I want to echo this point that different people are going to have different sort of risk tolerances and decisions about risk at the moment. And it might be because of things like Carrie alluded to in terms of upcoming travel. It might be because of different exposure or different interactions with people who might have be in immunocompromised situations or just have other health conditions. And I think we also need to then, along with that, then normalize that sometimes you might be in a situation where suddenly you don't feel as comfortable as you thought. So, I think there are cases where the party invitation might say masks will be required. And then you walk in the door and, people aren't wearing their masks. And I think that we need to be thoughtful about it's okay if some people do keep their masks on. I was at an event, a lunch, and someone kept their mask on the whole time and took their lunch to go at the end. And they just sort of said, they were trying to be extra cautious and very non-judgmental and kind of recognizing that different people are going to have these different situations and might make different decisions in the moment. And that we can sort of do that, and each person can make the decisions that's right for them with the information that they have about themselves and their family.
So we all work in public health, and we are in a state where lots of people are vaccinated, but not everybody lives this way. So, Carrie, I wanted to ask you, there are a lot of communities in this country where the vaccination rates are low, and this new variant could cause serious damage. And I'm curious sort of what thoughts you have for those places.
So, I have a lot of family in those places. To be, full disclosure, I know where you're talking about. we visit those places. And, I think it's just important to remember that COVID has impacted everyone. No one has been, has been able to escape this. And how people respond is different. It's shaped by culture. It's shaped by belief. It's shaped by science. It's shaped by politics. It's shaped by everything. We're not living in a bubble with COVID. We're living in the world with COVID. So the thing that I, just encourage people to do is to know your own risk tolerance. And it does take that thoughtfulness, that, 15 minutes to think through, do we really want to go to this event? What will we do if we show up there and we're just not comfortable? Or is it time for us to scale back our family activities because we're seeing more transmission in the schools or at sporting events or, even in the workplace or the community? And so it is about, thinking through what you will want for yourself and your family and really sticking to that, being truthful about your own risk tolerance to yourself, and then, extending grace to others and also receiving others' grace when it comes to the precautions that you may take. And remembering that, as Liz said, we're all in a very different place with our individual families, with our needs for connection. It's been a long, nearly 2 years. So just remember that everybody is now versed in what the toolbox is. We are versed in how we move in terms of more conservative risk exposure to more liberal risk exposure. We know how to do that, and everybody is making their own choices.
And Liz, I'll leave you with the last word.
I think this is a great point to end on. And I want to pick up on this point that Carrie's making. People have different risk tolerances and sort of levels of risk in their family. But also right now, we unfortunately have a lot of differences in access to some of these really important public health tools. So we've mentioned rapid tests repeatedly as a sort of fairly easy to use approach to give information in the moment about whether someone is infectious. And sadly, those tools, that test is not available to everyone equitably at this moment. I think we really need government efforts at the local, state, and federal levels to make sure that all of the tools of public health, including rapid tests, are equitably available to everyone in the country. And that will really help us move forward through this pandemic.
Liz Stewart and Carrie Althoff, thanks so much for joining me.
Thank you.
Thank you.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.